I'm Dr. Luke Frame. I'm a third-year resident at the Dayton VA Podiatry Clinic. Our first year, it's most of our off-service rotations. We go do all of the rotations that are required, and then we also have plenty of time to also be on podiatry, but those are mostly done in clinic and on call so that we can learn the ropes of how to actually be on call consistently and how to actually manage a workload of call. Our second year, we also have call. After second year, you're just on podiatry for the rest of the time. So it's more geared towards trying to get our numbers and trying to get our surgical numbers, and also learning how to be more efficient in clinic. And then our third year is kind of the icing on top, where we're not on call very much, and then we're going to surgeries quite a bit. We're a lot more trusted with our patients here in the clinic. We're able to see them, quickly go talk to our attendings, and they say, hey, yeah, you're good. So it's kind of nice because it's more of your clinic and your surgeries that third year. We get exposure to sports med. We get exposure to also bunions, hammer toes, ankle, subtalar joint arthritis. We do tend more towards wound care, which is nice, so that we can manage those more, and we're more consistently seeing those. But we do get a smorgasbord of everything, and I feel like I've gotten all that I need to be able to hit the ground running when I'm out of residency. So I'm lucky enough that I have a family, and talking to all of my colleagues kind of outside of the VA and talking to them about their experiences, there were times where they would tell me, oh, I didn't get to see my kids this week. And I've luckily been able to learn everything that I need to and still see my kids every night and help put them to bed. We're all right next to each other, and if we have a question about a patient or are trying to think of different diagnoses or what could be on our differential, we can talk amongst ourselves and try and figure out really what's going on. We are all constantly looking at the different imaging, whether that's x-rays, CT, or MRIs, and learning from each other and learning from each other's experience. The attendings are there, but they definitely let us run the show and make it feel like the OR is our OR. They're letting us learn and helping us get the hand skills that we need. Outside of the VA, the way it kind of works, as long as you come prepared, most of the time they will let you do at least 50% of the case, if not more, depending on how prepared you are. You do, though, have to come prepared and show them that you are trustworthy, because it is their patients, but you're definitely getting the hands-on experiences that you need. I've had times when I've gotten to do an MIS bunion case from start to finish myself, and definitely had experiences with rear foot where I'm doing 75 to 95% of that case, and they're just stepping in when I needed a little push in the right direction to get things lined up correctly.
Hi, my name is Caesar Roman. I am a third-year resident here at the Dayton VA. So my experience in the OR is really hands-on. I think it's really great hand skills. You see a wide array of cases, everything from ankle fusions to INDs, soft tissue to bony work, forefoot, rear foot. I think we get a really good experience, a well-rounded experience in the OR. My relationship with the attendings at the VA is obviously very strong. You know, I work with these people all the time. I think I have a great working relationship. We can make jokes, but we can also get to work. It's never incredibly stressful, but it's never incredibly lax. I think it's a really great working environment. As far as attendings in the outside, everyone has a different working style, and I think it's really great because you get to see what works for some people, what doesn't work for other people. And I think the best part of the outside attendings is that they're all open to having their brains picked. So the call schedule is fair. You know, obviously as a first-year resident, you're taking a lot of call, but that's because, you know, you have to get all of the experience that you need so you can work on your own. As you progress through the call schedule, the call decreases, but that is for the best, and I think it's really fair. So as a first-year resident, having an attending or a more senior resident with you is really helpful. You don't really know what you're doing the first couple of weeks out of podiatry school, and I think having that hands-on buddy system is really great for learning and getting your feet wet and giving you that confidence. The wound care clinic here is very robust. You're seeing a wide array of wounds and different treatment modalities, so if you're interested in wound care, this is the place to be. One of the most interesting things about this program is how you work with different disciplines, especially vascular and infectious disease, to manage wounds. Oftentimes we're working hand in hand with infectious disease in the same clinic at the same time to figure out what's the best way to treat the wound and which antibiotics are going to work the best. Being in Dayton, there is a lot to do outside of the office. If you love nature, there's a lot of great parks, a lot of great restaurants. We're only about a 10-minute drive from the Green and have some great shopping. Other things to do in Dayton is go check out the Dayton Dragons. The Air Force Museum is really interesting, and if you love history, so that's really fun. I brought my family there before and they really loved it.
So my name is Dr. Alicia Wallace. I am currently a third year on my way out of residency. Going to be starting attending job here shortly. I'll be staying here in Dayton. I will be working at the Dayton VA VSC block. So that's like outside clinic that's separate from the VA, but still affiliation with the Dayton VA. I feel that the Dayton VA program is structured in such a way that it allows you to have a family life as well as being able to focus on being a resident and learning, you know, what that entails, like being a physician and learning your surgical skills. I actually had a baby in residency and I felt that I took call with a newborn and I've managed it very well. Our program is structured as very family friendly. So I don't feel that in any way that I was overwhelmed. My attendings were able to, you know, have an open door policy anytime that I needed to come to them for something, whether it be work related or personal, they were very understanding. A normal day in clinic typically entails seeing about 20 to 40 patients a day. Typically we have enough residents here if you're scheduled to be in the clinic, but we also have attendings that are more than happy to help out in clinic to see patients. The program is very well-rounded. I feel like regardless of whether I decide to take a more clinical position or surgical position, I feel that I am fully equipped with the skills that I need to succeed. 3 years go by very fast, and I think looking back, when I reflect back on my time here and my journey here, if I had to do it all again, I would certainly choose Dayton VA for residency.
Hi, I'm Dr. Daryl Ballinger. I was a former resident at the Dayton VA from 2010 to 2013. I really enjoyed working at the VA because I felt that I had the opportunity to work with veterans, but also through the program I had the opportunity to work with non-VA patients and work with other surgeons who really gave me the opportunity to perform surgery and also help manage their patients. On a daily basis, as a wound care center medical director, I am evaluating patients for their wounds and determining if they need surgical intervention. I do quite a bit of amputations and incision and drainage type procedures, but most of the time I'm trying to work with other physicians and other medical specialties to develop plans to ensure that the patients get the best care they can get. One of the things that I've learned is through the Dayton VA, I had a ton of experience working with patients who have wounds and how to manage them. I learned quite a bit about multidisciplinary wound care, from working with infectious disease, working with internal medicine, working with general surgery and orthopedics. I have found that learning how to interact and speak with other medical services has greatly enhanced how I actually practice today. Living in Dayton has been fantastic for my family. From the Air Force Museum to many of the shops downtown to many of the outlet malls as well. Being in Dayton gives you the opportunity to have a family you can grow and afford to do the things you want to do. At the end of my third year, I did have multiple mentors reach out for me and with me to find employment post-graduation. So I was very happy, and it was very great to see that my attendings did want to see me grow as a podiatrist post-graduation. And succeed.